Welcome to this explainer. Today, we're tackling a really critical topic, stage 4 lung cancer treatment in Germany, focusing on both the options and the cost. Using some fantastic insights from Euromedical expertise and Dr. Hind Hlali, we're going to navigate the exact pathways for seeking advanced care abroad. Okay, let's jump right in.
If lung cancer has reached stage 4, does that mean the treatment options have run out? That is probably the most terrifying question a patient or their family can face. But looking at the absolute latest oncology data, the short answer is no. Modern medicine has shifted so dramatically in recent years, it's completely changed what this diagnosis actually means today.
Here is a crucial reframe for us. Stage 4 really just means the cancer has spread beyond its original location. It is definitely not a single uniform disease. Actually, it's a wonderfully and complexly diverse biological condition. Because of this, it requires a highly individualized precision planning strategy. Gone are the days of a one-size-fits-all approach. Two people with this exact same diagnosis might have completely different biological drivers behind their disease. So the very first major fork in the road for treatment is figuring out the specific biological subtype. Broadly speaking, we're looking at non-small cell lung cancer, or NSCLC, versus small cell lung cancer, SCLC. This distinction is huge. Because SCLC tends to spread earlier, it relies heavily on systemic treatments right out of the gate. Meanwhile, the pathway for NSCLC changes completely based on specific molecular findings. Knowing exactly which branch you're on literally dictates the entire medical journey ahead.
And this right here perfectly illustrates why personalized medicine is so vital. For non-small cell lung cancer, specialists look really deep into the tumor's molecular fingerprint by testing for biomarkers. Finding an actionable genetic alteration, things like EGFR, ALK, or ROS1, was kind of like finding the unique lock that fits a highly specific key. It's the absolute decisive factor in figuring out whether a patient goes down a targeted therapy path or an immune-based path.
Once that molecular fingerprint is fully mapped out, oncologists open up the modern treatment toolkit. And notice I said toolkit, not a menu. You don't just pick one of these off a list. The options here, chemotherapy, immunotherapy, targeted therapy, and radiation or local treatments, they're all utilized based on those specific molecular findings, any previous treatments, and exactly where the cancer has spread. Let's actually break down how a few of these advanced tools work in practice, starting with targeted therapy. Targeted therapies are basically the definition of precision medicine. Unlike conventional chemotherapy, which sort of broadly attacks rapidly dividing cells, targeted medicines are designed to specifically interfere with the molecular pathways that are driving that tumor's growth. But, and this is a really big but, they are only relevant when molecular testing identifies an evidence-based alteration. So, a treatment that works absolute wonders for an EGFR-mutated cancer will not automatically work for an ALK-positive disease. It has to be a perfect match.
Next up in the toolkit is immunotherapy, which, by the way, is a major focus in Germany for selected patients. Immune checkpoint inhibitors basically work by helping your own body's immune system recognize and attack the tumor cells more effectively. It's amazing science, but it isn't automatically right for everyone. Its use depends heavily on factors like PD-L1 expression and the overall molecular profile of the tumor. Plus, it can have unique immune-related side effects, which means you really need an experienced oncology team to monitor things closely.
Then we have radiation therapy and local treatments. While other therapies circulate everywhere in the body, radiation zeroes in on specific metastatic sites. It can be used to relieve pain from bone metastases or manage disease that is spread to the brain, for example. Interestingly, in carefully selected patients who only have a limited number of metastatic spots, a condition known as oligometastatic disease, focused local treatments might actually be deployed right alongside those systemic therapies.
Now, all of this leads to a really critical medical truth. An accurate treatment plan requires way more than just confirming that a mass is present. The pathology review, the staging imaging, and that comprehensive molecular testing, they all must be completed first. Seriously, rushing into a treatment or even choosing a hospital without this full picture could mean missing out on a highly effective targeted therapy or going down a path that just isn't biologically matched to your specific tumor.
Because these cases are so complex, the best care doesn't come from just one single doctor. It comes from what's called a multidisciplinary tumor board. This is essentially a collaborative powerhouse panel bringing together medical oncology, pulmonology, radiology, pathology, radiation oncology, and even neurosurgery if the brain is involved. They sit down and review the pathology and molecular data together to sequence the treatment optimally. This is really where true medical expertise shines in advanced cases.
Now, if you're an international patient considering care in Germany, you might be stressing about the logistics of travel right now. Well, here's some great news. An international second opinion often begins completely remotely. You don't need to rush to board a flight. In fact, a truly meaningful pathway begins by securely sharing your pathology reports, imaging, and molecular results for a remote review. This way, your case can be matched to the correct oncology team before you even pack a single bag.
And that brings us to a vital distinction when you're seeking care abroad: the difference between a standard medical booking agency and physician-led coordination, like the services provided by Euromedical expertise. Physician-led coordination means a licensed specialist actually reviews your medical file to understand the real clinical reasoning behind your options. They make sure your biomarker profile is complete and ensure you're matched with the specific thoracic subspecialist you actually need, rather than just pointing you to a famous hospital and hoping for the best.
Let's take a quick look at this transparent coordination pathway. Step 1 starts with you submitting your medical records so a physician can review your exact diagnosis. From there, your case is matched to the right specialist or tumor board. Only after the hospital assesses the case and gives you a specific financial estimate does the actual travel planning begin. It's a very logical flow, and it totally prevents you from wasting precious time and money.
So, to kick off that remote review, whether you're a patient in the US seeking a second opinion or in the GCC looking to transfer your care, you need to assemble the right documents. Think of this as your medical passport. You're going to need your pathology reports confirming the subtype, the actual imaging files from your recent CTs or MRIs, all molecular and PDL-1 results, and a really detailed summary of your treatment history so far.
You know, patients frequently search the internet for the best lung cancer doctor in Germany. But the reality is, there is no universal best doctor for everyone. A famous name just isn't enough here. What actually matters is identifying a team with documented experience in your exact lung cancer subtype, your specific metastatic pattern, and the exact multidisciplinary expertise your case requires. Matching the right doctor to your molecular profile is what truly defines the best care for you.
Often, patients find themselves comparing seeking care in Germany versus Switzerland. And look, both countries possess highly developed medical systems with premium university and certified cancer centers. But neither country is universally superior for every single lung cancer case. The choice shouldn't be based on some general country ranking. Instead, it should be based on which specific center has the precise thoracic oncology expertise, the radiation capability, and the treatment pathway access that your individual case actually demands.
Okay, let's address a very practical concern: the cost. For self-paying international patients, transparency is absolutely key. Diagnostic workups have baseline published prices at centers like University Medical Center Freiburg. You're looking at starting around €6,000 without a PET/CT and around €9,000 with one. However, the actual treatments, things like chemotherapy, targeted therapies, or radiation, those are highly individualized. They depend entirely on the specific drugs chosen, the number of cycles, and the duration of care. That is exactly why a personalized hospital estimate is always required.
Now, here's a fantastic benefit of structured international coordination. You don't necessarily have to relocate to Germany for your entire treatment. In a lot of cases, the specialist review, pathology confirmation, and the overall treatment strategy happen in Germany. But the routine treatment cycles or follow-up imaging can be safely coordinated and divided with your oncology team back in your home country. This vastly reduces the travel burden and, most importantly, allows you to stay close to your family support system.
We'll wrap up with this absolutely vital takeaway. If you are considering stage 4 lung cancer treatment in Germany, you must start with a physician-led review of the pathology, imaging, molecular results, and previous treatment history before you choose a specialist or hospital. You have to let the biology of your disease dictate the expertise you seek. So as we end this explainer, I want you to ask yourself, do you fully understand your tumor's specific molecular fingerprint before making your next major medical decision? Thank you so much for exploring this with us today.